All right, so let's start this broadcast with the big story that we are tracking on WION at this hour. Now, it's pretty rare and difficult for information to, in fact, seep out of China because Beijing maintains a pretty firm hold in keeping certain things secret that it does not want the general public to know. But sometimes information does leak out from within China. Now, there is an interesting bit of information that has come forth in terms of the mystery illness that has been witnessed in China, which has been making headlines globally over the course of the last few weeks. Now, there are reports that a doctor in China claims of a new local mystery illness outbreak on the 13th and the 15th of December at a school. And all 30 children reportedly got infected and also developed fever besides other symptoms. A boy was reportedly infected with mycoplasma and had psoriasis all over his body. But this comes at a time when the Chinese officials claim that the situation with regard to prevention of respiratory infections has remained pretty stable. In fact, authorities have said that China has recorded a decline in the number of pediatric respiratory infections. The decline has been reported at both secondary and higher level medical institutions nationwide. The World Health Organization has been monitoring a rise in respiratory illnesses in children in northern China since the middle of October. China has attributed the surge in the number of infections to several factors, including that of the lifting of the COVID-19 restrictions and the arrival of the cold season, and due to the existing pathogens such as influenza, mycoplasma, and other respiratory syncytial virus. The children generally get affected by mycoplasma pneumonia and RSV, and earlier there had been these pretty strange images that had emerged in China of children doing their homework even while they were hooked on to IV drips. It was bizarre as to why children still have to do their homeworks when they were being given these IV drops. The hospitals were flooded with sick children, and there were queues of patients that were seen outside of many pediatric hospitals in China. In late November, health facility in Shanghai was receiving more than 8,000 outpatient emergency visits, and it was distributing nearly about 1,400 outpatient intravenous drips per day. The world over, the countries are reporting a surge in infections related to pneumonia, and according to the latest, the Japanese authorities have also sounded a bit of an alarm about the rising infections, especially in terms of flu. Now, the average number of cases per medical institution has also surpassed the warning levels. Authorities say that as many as about 5,000 medical institutions nationwide have reported over 166,000 flu patients since the 10th of December. The figure is up from 34,000 that was recorded in the previous week. All right, now to give us more insights into this, we're being joined by Ms. Jennifer Zheng. And Ms. Zheng is in fact a member of the International Press Association and is also the host of Inconvenient Truths by Jennifer Zheng, and she's joining us on this broadcast. Now, Ms. Zheng, this is an interesting bit of information that has come in. Now, how do we know that this is a mystery illness that's separate from the mystery illness that we've been talking about and that has been making headlines globally since at least the month of November? Is this something separate, or is it related to those same infections that we've been talking about since last month?
I think at this stage, it is hard to know because the Chinese authorities, as you mentioned earlier, they tend to cover up the truth or not talk about it. So from the official released news, they are talking about multiple different viruses. They list several kinds, 7 or 6, or I think sometimes they even talk about more than 10 different kinds of viruses. Of course, they list the COVID-19 sometimes as the number 1 virus to be guard against. But anyway, they claim there wasn't any new variant going on. But if you look at what they are doing now, number 1, they have emergently gave permission to 5 new vaccines that is especially designed for the XBB variant. And 2, they are pushing for people to get vaccinated. And 3, they are conducting large scale of emergency drill about vaccine related incident. So it gives people a feeling that this could be still something that's related to COVID, and also there could be some problem or a vaccine-related incident. That's why they are conducting large-scale drills to deal with this emergency incident in many different cities. I
Right.
shared a TV report from Chengdu City where the drill happened on November 17th.
Right. Now, you know, the obvious question is this an infection that's affecting only children? Because the last time around it was said that that's some kind of a pneumonia or a similar kind of a respiratory infection that was predominantly affecting children. This time around, is it again similarly the case that only children seem to be more prone to getting infected with this new virus, if that is what it is?
I think when the outbreak first started, actually it's not in October, it's in September. It's already started in a northern city called Shenyang. And then it spread to Beijing, Tianjin, and Shanghai in October, November. And the first stage or initial stage of this wave of outbreak, yes, the majority of the infected were children. But there were also reports that adults and elderly people are getting sick too, especially recently the death of a very famous Hong Kong actress who moved to China, of course, caused widespread attention because she was acted as the ambassador to promotion vaccination, and she
Right.
got 4 doses of vaccination. So it seems actually I listed a number of other cases of adults that in their 50s suddenly die, all claimed to die of sudden heart attack, but that is far way, I think, much more than what we see in the usual days or normal years.
All right. Thank you very much indeed, Mrs. Yang, for joining us and getting us those details there. WION is now available in your country. Download the app now and get all the news on the move.